do poor wireless. Hey, hi. I had poor wireless connection there for a minute. Oh my God. My friend Renee D posted an iconic this morning. Your internet signal is the new luxury good, right? We all need that. It's desperation. Well, welcome, Lifescapers, to the end of July. Hard to believe we are over halfway through 2020, which is a year we will all be happy to be past. A little COVID update. The U.S. just topped 4 million confirmed COVID cases. Of course, some of that is due to we're testing much better. But to understand, when scientists talk and physicians talk about an infection having exponential growth, the progression of this virus is a perfect example of that. We reached our first million cases. It took 99 days. We reached our second million another 43 days after that, third million in 28 days, and 1 million cases in just the last 15 days. So in medical terms, we call that a scary actor virus, so with a lot of stealth transmission. And we know that the case numbers are probably an order of magnitude higher, tenfold higher than the actual numbers because there's so much stealth or asymptomatic transmission going on out there. Over 143,000 people have died in this country, which is heartbreaking, and a quarter of the globe's COVID mortality. But on a positive note, we are getting our act together in Arizona. And since that mask mandate at the beginning of this month, we've definitely gotten the R0, that infectiousness number, to the magical place below 1, where we have the potential to drive this virus out of the community. So that is super exciting. We're seeing a definite decline in cases. We are all breathing a sigh of relief. There's been a definite decline in hospitalizations, in ICU use, in ventilator, patients who are on ventilators. Now, there are still thousands of people very ill with COVID in the hospitals. And so we are not past this by any stretch. This is an endurance event. And I hope if we've learned anything from our experiences and our missteps, and I have to, give the governor kudos yesterday for saying, we are not out of the woods. Keep masking up. As we reopen or, consider reopening things, let's ease off the brakes and not hit the accelerator again. Because if we want to open our economy and open our schools, as other nations have been able to do, we've got to each do our part. And that's engaging in just these simple common sense measures. We all know what they are. I don't have to say it again, but we want to keep that infectious rate as low as possible. And with such high rates of stealth infection, we just have to assume everyone could be a vector of this infection and behave accordingly. No nation has successfully opened schools without getting the outbreak under control first. And I think the school districts are all realizing that and all trying to figure out strategies. And I know many of our patients are teachers. Certainly many of them are students, parents. A lot of our staff are wondering what's going to happen with their kids in class. So, we all want that to happen. So let's keep up the good work. I'm really happy to hear more sensible, consistent messaging and overall compliance with these recommendations. But I have to wonder why there's still so much controversy. So I think it was worth touching base on a little primer on critical thinking. Plus, I got a little bit schooled in this just this week with something I posted on the Brilliant Health community. So it was a perfect segue into critical thinking in the age of information overload. So as I often say, we are drowning in information and starving for wisdom. And as that torrent of information is all descending on us, it pressures us to seek overly simple answers to complex issues, to jump to conclusions, to defend dogma at the expense of common sense sometimes, and to sometimes, myself included, inadvertently contribute to a pandemic of misinformation. So how do we become better information consumers? Or as our clinical psychologist, Dr. Lisa Stroman, who started something called the Digital Citizens Academy, how do we become better digital citizens? And I suggest just the simple thinking about ABCs. Ask, address biases, and caution. So ask, I think one of the most important is ask 3 questions, the Socrates questions. Is it true? How often are we really fact-checking the things that we're sharing? Is it kind? And is it necessary? Simple questions, but, as with Socrates, great wisdom. Biases are something that require us to do a little bit of introspection and become aware of them, and then engage maybe in some countermeasures, hopefully. So first is my favorite, confirmation bias, which is what caught me up in posting something that ended up failing in fact check this week. And that is looking for or only accepting information that confirms your already strongly held beliefs. This is something that I think is really resulting in a great polarization in our country and an inability of us to actually collaborate and listen to each other and work together. So how do you counter confirmation bias? One is purposefully review opposing views. I know researchers who have all their grad students constantly look for papers that refute what they're trying to show in their research. Or even better, study and debate the opposing view. That's a powerful way to just get a different perspective on an issue that you may not understand the full level of complexity to it. There's also the Dunning-Kruger effect, which is, as my grandfather used to say, the more I know, the more I realize how little I know. So the more you learn about something, the less certainty you have. I stay away from know-it-alls. Anybody who thinks they know it all about anything is usually insecurity masquerading as arrogance, or they're dangerous, because today's dogma is tomorrow's dog, you know what. Stay humble and learn consistently, ideally from quality sources. So what are your sources? Filter your inputs. Third is what's called the misinformation effect. So perceptions are heavily influenced by how they're presented, okay? The post that I put on Brilliant Health page the other day about kimchi and potentially helping with COVID, the way that the headline was portrayed made it sound much more compelling than what any factual backing to it might convey. So you want to seek balanced and accurate sources of information and expertise. I want to listen to smart people. I don't know about you, but I think it's important. And avoid the inflammatory, opinionated, or clearly sites that are conflicted or are just there for entertainment. Those are really not going to be quality sources. There's also something we call the self-serving bias. That's the tendency to credit ourselves with successes or good behavior and blame others for everything that goes wrong. And, humility, including taking responsibility for failures or admitting when you're wrong, is a superpower. And that is something that I will always look for in the people I look up to and listen to. Availability bias is important in this day and age, because most of the public has no pandemic experience. Those of us in medicine, I have, studied the 1918 flu. We've learned about pandemics over the years. We've studied SARS and MERS. We've lost 3 patients in the H1N1 epidemic. So we are very, very highly attuned to these pandemics that we know are going to come out every decade or so. But those whose it's not in their experience really don't have any basis to understand this. And like a wildfire, if they don't see it in their backyard or in their loved ones, it just doesn't seem real, and it's easier to just pretend that it's not there. And then finally is the optimism bias. And that is the tendency to underestimate your risk. So that's not a bad thing, because there are, definitely lots of studies showing the more optimistic outlook can improve outcomes with a number of different things. If you're, clearly in a negative mode, you're likely not to do well. What you focus on tends to be what happens. But a lot of people out there seem to think they're at low risk and really don't know that they have high blood sugar. That hypertension, even if you're treated with medication, is a risk factor. That having that waist that's bigger than your hips, that central obesity, is a risk factor. And should be more cautious because of that. So those are some biases to attend to. And then the final thing of the ABCs is caution, and that's just hit the pause button before sharing or copying, which I did not do this week. And I will learn my lesson. My daughters have schooled me, and hey, I'm imperfect like everybody else, and we just got to learn from our mistakes and hopefully not make them again. But I'm sure I will. So I know now all of you are committed to being excellent digital citizens. So I think it's really critical at this point. We're 6 months into this this pandemic. How do we transcend this experience? So I wrote a post a few weeks ago in our concierge newsletter that I'm going to reiterate to a bit, but talking about the secrets to resilience. Because resilience is a challenging thing right now, and even before the pandemic, our rates of depression and suicide and what we call deaths of despair, overdose, alcohol-related deaths, etc., were sky high for and America, worse than many other places, many other economically advantaged nations. So I always think back to my parents, who were truly the greatest generation. And why were they called the greatest generation? They epitomized resilience born of shared sacrifice. Resilience born of shared sacrifice. My mom was 8 when their family lost everything in the Great Depression. My dad was barely 20 when he parachuted behind enemy lines at Normandy. The Great Depression lasted over a decade. My mom was a senior in college and said World War II broke out, and that's what cured the Great Depression, a decade of severe depression. So if my mom were alive today, I have no doubt that any complaint from me she'd come back with, "You think this is bad? Honey, be grateful you haven't seen bad." So where are we today? In some ways we're distraught, depressed, demoralized, divided. We're angry, apathetic, and anxious. And that's what, I'm seeing a lot of. And what will we be known as? Will we be known as the me generation or the selfie generation, where personal entitlement eclipses all else? I truly hope not. And I have hope, and I have trust in the power of the human spirit. In over 3 decades, I have had incredible fortune to take care of dozens of Holocaust survivors, prisoners of war held for many years in horrific conditions, and people who've overcome hardships that I can't even comprehend living through, much less moving beyond. And they've taught me a lot. And I will say those who chose, and it is a choice, those who chose to dwell in bitterness, resentment, blame, and anger, sustained and even magnified their misery and made life miserable for everyone around them. As Mandela said, resentment is like drinking poison, expecting it to kill your enemy, right? Those who thrived in spite of the hardships that they endured offered a ton of lessons. And those were the ones that chose a different way of focusing. And I think these lessons are really critical as we endure this and future catastrophes. We've been very, very blessed to not have much in our lifetimes before this. Number one is appreciate simple pleasures. Treasure and attend to what is truly important. I'm hearing from patients all the time the little things that are just making their day, or they're sending me pictures of their gardens or beautiful sunsets, or kids pictures of grandkids or what have you. Pets are really way up there. The two is the serenity prayer. My sister passed away at age 42 26 years ago, and the last thing she sent me was the serenity prayer, and it's always on my bulletin board. But it's basically adapt and accept the things you cannot change, and then work hard to change the things you can. Choose a positive attitude. Attitude is a choice. Control is an illusion. The only thing we can control is how we steer when we hit the rapids. I just was speaking to a patient about this morning, who the family is coping with cancer. Treasure life and health, knowing they are precious and fragile. So both the pandemic and health difficulties really bring that to light, and that's one of the blessings of working in medicine, is I get to see that every day. Never take health for granted. Develop an inner life that nourishes you. The only person that can make you happy is you. So what are you doing to heal your spirit? It can be simple breathing practices, prayer, meditation, mindfulness. It can be creativity, art, singing, journaling, dancing, all of those things. But have a self-healing practice. When I ask patients that for many years, what are you doing? What are you doing to manage stress? Or how do you recharge your batteries every day? How do you self-soothe? And I would get a look like I was from another planet. We've not been taught that, and that's part of, I think, the lack of resilience in our culture. So practice those things, teach your kids how to do them. Clearly one of the most important pieces. Also reach out, connect with people, create a support network. Think about those people in your life who are lonely or really trapped because of their risk factors, and do what you can to just make life better for them. Doing what you can to uplift others is the greatest antidote to despair. And there's a lot in the community, clearly, who need uplifting right now. Hope is a superpower, so we need to hold tightly to it. And as my mom often said, this too shall pass. My father-in-law always said, nothing is ever as bad or as good as it seems. So just know, this normal is not going to last forever, but things are never going to go back to where they were. There are things we're not going to take for granted anymore. I can guarantee that, at least for a while. And then never doubt the power of the human spirit. Like I said, I have seen people transcend things I cannot comprehend transcending. And do it with grace and dignity, and they're incredibly inspiring. So, hey, read about those people. And then finally, my favorite, one of my favorite Jewish guidelines is Tikkun Olam, heal the world. Be fervent stewards of the things we value, our health, each other, our children, our planet. So my hope is that we heed these lessons, we reignite the healing forces of civility, collaboration, consideration. As my husband said on July 4th, we ought to call this Interdependence Day, because, our rugged individualism worked to a point, but to overcome this particular problem, we need to depend on each other. So I thank you, and I'm going to see if we have any questions, so go for it.
What are the top preventative things we can do to fight COVID-19?
So, first and foremost, take care of yourself. I think one of the reasons that our patients, knock on wood, and I don't want to prematurely gloat because it gets you every time, but I think one of the reasons our patients, even our highest risk patients who've contracted COVID, have done incredibly well is because they've invested in their health. They've invested in working with Dana on how to improve their diet. They've worked with us on reversing risk factors like prediabetes and hypertension and cardiovascular disease and. So number one, take care of yourself. That one of my patients said the other day, in COVID, you're either a hunk, a chunk, or a drunk. So the hunks are people like my husband, where exercise is their sanity preserver. So they just get in better and better shape. And the chunks are those of us like myself who, have put on a COVID 5 or 10 or what have you, or tend to resort to the chocolate or carb stress eating, right? And drunk, speaks for itself. But yeah, eat a healthy plant-based diet, attend to quality sleep, engage in some kind of stress management strategy every day, mindfulness, meditation, prayer, dance, whatever, and get moving every day, and reach out for help if you need it. And then the other things are just the protective measures. Wear a mask when you're out in public. Really be thoughtful about weighing the risks of what you're thinking of doing. A patient had several friends go out to a dinner in a restaurant, and 3 landed in the hospital with COVID, one in the ICU. We have to be really thoughtful about what risk are we willing to take, and is it worthwhile, and how can we minimize that risk? And don't be afraid to talk to your provider about that. So, any other questions? Yeah.
What are some of the things that you do in your life to self-soothe and relax?
Well, I call the Calm app Sanity in My Pocket. I started meditating actually with Deepak Chopra's free meditation series many years ago now. And now I'm addicted to it because it has given me such equanimity. I am less hit by the stresses that come at me every day. My quality of sleep is better. My telomeres have gotten longer, so I'm de-aging at the genetic level, which is proven with meditation. So to me, meditation is actually first and foremost. And then I think exercise is also a critical thing. To me, indulging in nature is also my happy place. So if we're looking at getaways nearby, I have to have a nature retreat. And nature can be healing, just watching nature videos or putting nature screensavers up. So yeah, and then laughter is a superpower too. So engaging, listening to and watching things that make you laugh are, because I could geek out on COVID 24/7 if I wanted to, and that would not be a healthy me. So my drive home is usually some kind of comedy channel.
Do you recommend the neti pot for nasal cleaning every day to help fight against COVID?
I don't have any proof that that's actually protective against COVID. I think it doesn't hurt if you tolerate it. Some people, I can't tolerate the hypertonic salines. They're too irritating, and I've had some patients where they're caused ear problems or or nasal problems from just irritation. But if you're using a pretty normal saline solution, I don't think it hurts. It also reduces the congestion we might get from dust and pollutants and pollens and things like that. But I don't have any proof that it's protective against COVID. We don't have proof of much of anything being truly preventive or therapeutic for COVID. We've got a couple clinical trials that are showing some promise for some things, but I can't say with any definitive proof anything that's preventive.
Which foods can boost our immune system to help ward off or fight the coronavirus?
Well, again, I don't have, I can't say specific foods specifically for targeting this virus. We know that certain foods are definitely more antioxidant rich or supporting of different immune functions that might help us in if we're faced with COVID. So, certainly what we're always pushing, colorful fruits and vegetables. I suggest organic as much as possible. Things like cruciferous vegetables, the broccoli, cauliflower, kale, things like garlic and ginger may have some specific immune moderating things. Green and white tea, great sources of antioxidants if you tolerate them. And again, I think variety is really critical. My husband and I have this talk every now and then about, is your diet a tropical rainforest or is it a cornfield in Iowa? If you're eating the same things day after day after day, even if they're healthy, that's probably not the best. Diversity rules in nature. And also getting some fermented foods, again, if you tolerate them. Some people have difficulty, but I like organic. I have a organic cashew yogurt that I do. I love kombucha as like my cocktail every now and then, or my glass of wine. It's a glass of kombucha, or some fermented, like the wild brine fermented sauerkrauts or kimchi, which was that whole post this week, but I still love it, and it's good for the microbiome, so I'll take it. It's not great for the breath, though. I will say that. Any other questions? All right. Thank you so much. Stay safe, stay healthy, and thanks for passing this information along and hanging in there with us and just being terrific. Have a good one.